John Bramnick's tavern in his living room on multiple occasions. I will admit to that. And Steve and I have knocked a few back over the past several years. So I'll come back to that in a second. Judy and Tina can give you the why and wherefore in terms of how it's calculated, but it's a very simple sort of, for me, for folks trying to figure out why it's important and where the breakpoints are. Anything north of 1.0 is bad. Anything south of 1.0 is good. We show a chart, which we showed earlier. I believe at the peak it was 5.31 or 5.36, which is jaw-dropping, and my guess is that was among the highest, if not the highest, in the country at the time, along with New York City, which means, let's say it's 5 and not 5 point something. For every, and Tina will correct me here, if you've got it, you're infecting on average 5 other people based on your own infection. And that's been coming down, thank God, and now when it gets below 1, you are beginning the process of driving it into the ground because you're infecting less than one person each time you're in that sort of contact, and there you can see it right there. It looks like we got to 1 to 1 just after Easter, and I think Easter, Judy would remind us, right around there, maybe Easter Monday or Tuesday, upon reflection was our peak, and so that's sort of where you saw the break point, and it continues to be something that we watch. And by the way, we have every day we have a warm-up call, and you know, when it goes from 0.65 to 0.75, we're noticing, right? And I want to repeat to folks, whether it's spot positivity, rate of transmission, new hospitalization, we're not hanging our hat on any single day's move, either good or bad, by the way, good or bad. And again, the fatalities, as awful as the losses are, those are lagging indicators. Those are folks who were infected some time ago. The spot positivity, we give you the date every time we say it. In this case today, it's from the 14th, which is Sunday. The rate of transmission is literally, as you can see, is as of the 16th, and new hospitalizations are literally over the past 24 hours. So those are literally in the here and now. And so, I'll yield my time after this. Listen, we have, I think, we have had an open book. I mean, we sit here every day. I'm told this is the 81st day I've sat here and presented the data that we present every day. And Sheila Oliver, to her credit, was doing it for about a week before I was here because of my surgery. We share the data with everybody, not just with the legislature, with the congressional delegation, with the business community, with obviously the healthcare advocates and community, with the millions of folks who have watched us over time. We're an open book. We are an open book. And so whether it's to John or Steve, and I missed what they had said, so this is the first I'm hearing that, we couldn't be more transparent, and we try to signal as best we can. I'll use today's guidance on malls. So here it is, Thursday the 18th. We've now signaled that a week from Monday, the 29th, giving 11 days runway, which the mall operators had requested. I was back and forth with one of the big ones, David Simon, this morning, giving him a heads up. I think that's my opinion. We're open about it. We're responsible. We're giving the data that we're basing it on, and we're giving not only that, but folks a sense of the runway that they're now going to be able to adjust to in the new life going forward. Whenever it is we get to indoor dining, to casinos, and I hope it's sooner than later, we want to give a similar runway. Catering halls have been asking us for that guidance, and we want to not just say, hey, listen, it's going to be tomorrow, but this is the data that we're looking at, and this is the runway we're giving you. With that, Tina, Dr. Tan. We'll go to Dr. Tan and we'll come back.
So the RT is also known as the effective reproductive number, and it's basically an estimate to what the governor was saying. It's an estimate of the number of individuals in a population that might become infected as a result of being infected by a case of COVID. And because the RT, it's an estimate, and it's based on a lot of different assumptions that go into calculating the RT for a given time. It takes into account things like the susceptible population. The day-to-day RT isn't necessarily as critical as the overall trend in the RT over time. And from an epidemiologic perspective, the RT is useful in terms of just kind of adding confirmation to what we know from our routine surveillance and epidemiologic data. So on a day-to-day basis, our epidemiologists in our communicable disease service, we look at the case counts over time, our epidemic curve, right? Which again, to what the governor had mentioned, we saw the peak in the number of cases during the first week of April. And then, we also look at things like the daily positivity rate. We look at syndromic surveillance data. That's data that we get from emergency departments for COVID-19-like illnesses, because that's also a nice surrogate to, to provide a fleshed out picture. Because again, the RT alone, just as one number, is just a number. Many different assumptions. People can calculate RT in many different ways because again, it's a model. But that epi data is also important in the context of what we practically see at the healthcare system. The reality is that we have to balance it with what the healthcare systems are seeing and able to accommodate in terms of their ability to treat patients as well.
Judy, anything you want to add? You're good.
Yeah, I just encourage everyone to look at the website that the Communicable Disease Service puts up, because a lot of what Dr. Tan just shared with you is represented on the website with great explanations, and it's the infographic will give you a nice picture of what they look at every day, and we meet weekly, and it's shared, and we look at things every day, every week, every month.
Thank you. Dave, you had real quick.
Yeah, just a real quick follow. What about this notion that they're suggesting that they should be included in this process of making these decisions? Do you think that's fair or not?
I'll repeat what I said. I think we've been extremely transparent and open. We have regular calls with legislators, both as a group as well as individuals, and I'm proud of the fact that we come up here every single day. We lay it on the line, completely transparent. We give folks a very precise sense as to how and why we make decisions. As I said earlier, we give folks a runway to let them prepare, so it's not a lurching process. Again, I'm not suggesting we're batting 1,000, that we're perfect by any means, but I think in terms of being an open book, I don't think we could be more open. I want to thank Judy and Tina, as always.